Feel good? All right, go ahead.
Good morning. Thank you all for being here. I'm grateful to the members of the Board of Aldermen who voted for this important measure and are joining me here today. And I'm also appreciative of the advocates and healthcare leaders like our very own Dr. Mati, who are here to speak about the importance of this legislation. A few weeks ago, I stood in this very spot and I said I would fight like hell to make sure St. Louisans can access the reproductive health care that they need. And today, we won the first round in the ring. The Reproductive Equity Fund will support St. Louis families at every stage of pregnancy, helping alleviate the healthcare disparities deepened by the COVID-19 crisis, while putting more resources towards incentives. This $1.5 million fund will offer resources for postpartum recovery, as well as lactation help, doula access, and provide abortion access through logistical support, and more. Every family deserves access to reproductive health care, especially those who have struggled to access care during the COVID-19 crisis. But our state's abortion ban pushes those families even further to the brink. Already, we can see who's been hurt by the overturning of Roe v. Wade. Abortion bans hurt the young girls who have to cross state lines to get abortion care because their state no longer makes an exception for rape or assault. Abortion bans hurt those who have already faced difficulty getting access to reproductive health care when COVID-19 hit and now face an even steeper climb. Abortion bans hurt the working people who can't afford childcare, a hotel, or time off from work because they need access to abortion care. Sorry, I lost my notes. Because they need access to abortion care. Abortion bans hurt frontline hotel workers, small businesses and restaurants that rely on economic activity generated by conventions who now question whether they want to spend money in our state. Last year, the city estimated that St. Louisans lose out on $5 million in economic activity every time we lose a convention, and those missed opportunities cost everyone in our state. So while the legislature pulls the welcome sign down, it's up to us to put it back up and show St. Louis is an innovative, forward-thinking, and dedicated to protecting the health of our residents. Today, we are joining cities like Austin, Portland, and Cincinnati, dedicating municipal resources to helping connect families to reproductive health care. But this is only the first step in the fight. The Attorney General, fresh off his latest campaign to sue China, has threatened to sue our city if we take this important step to help residents. Let me be clear. I will work with anyone if it means delivering for my city. But in this case, I think he and I have been on separate sides of this issue for a while. I believe abortion is health care, and that health care is a human right. He does not. I believe, and a majority of Missourians believe, that reproductive decisions should stay between St. Louisans, their God, and their doctor. The Attorney General does not. And I believe Attorney General Eric Schmidt is filing lawsuit after lawsuit to cover up his bipartisan record of working with me across the aisle and other Democrats in Jefferson City, hurting St. Louis families, and all to benefit his Senate campaign. The people of St. Louis elected me to take action to protect their interests, to fight for them, and to call out injustice when I see it. That's my commitment, and I bring it into this office with me every single day. I will not back down when our opponents threaten, bully, or demean our city, especially the Attorney General, who's more concerned about chasing clout than care. So today, St. Louis is taking decisive action, showing our state and the entire country that we will not stop fighting to protect access to reproductive health care. This is about empowering people to make the best healthcare decisions for themselves and their families. And if the Attorney General thinks that he knows better than St. Louisans about our rights, our doctors, or our health care, or our neighborhoods and our needs, then I say bring it.
Good morning. I want to thank Mayor Jones, Congresswoman Bush, the incredible staff at Pro-Choice Missouri, and my colleagues for boldly supporting healthcare access for St. Louisans. I am proud and grateful to be here with you all today championing healthcare access for St. Louis. Work on this bill was underway before we knew for sure that Roe would fall, because St. Louisans have been without real access in our state for quite a while now. As leaders in St. Louis, we have been over-legislated by extremists in Jefferson City for far too long, be it on abortion access, raising the minimum wage, gun laws that would protect our citizens, and even now how we work to help our unhoused neighbors. We are determined to use every resource possible to fight for our constituents and meet the needs that COVID exacerbated in our community. Women and the people with the capacity for pregnancy. Let me say that again. Women and people with the capacity for pregnancy were some of the hardest hit by the pandemic and the economic and job fallout, and their access to reproductive health care along with it. Abortion is health care. Doula support for pregnancy, birthing, postpartum, and lactation is health care. This will not be the last time that we take bold action to protect the lives of our constituents and their ability to make the decisions that they need to for their best lives. Now I'd like to bring up Alderwoman Shameem Clark-Hubbard.
Good morning. I just stand up here again to echo the rally and the cries that we have all worked for tirelessly in the bold action behind our Mayor Tashara Jones on this most important legislation. Creating this, what we've said today, I think the most important thing is access, right? And we are all here, that's what we were all called to do, is fight for the access of our constituencies, the access of the people of the city of St. Louis, and hopefully spread into the region of St. Louis. So as a proud Black woman, as a proud mother of daughters, this right here gives me the hope to then feed into them the hope that they can look up here and see that we are fighting for them, for their rights, right? Because these are rights at the end of the day. And so I want to thank all of our allies. I want to thank my colleagues. I want to absolutely thank Dr. Mahdi and our champion and our Mayor Tashara Jones. And we are continuing to stand behind you boldly in this effort. Thank you.
Good morning. Mayor Jones, I want to thank you for your unwavering leadership in getting this bill passed. I also want to thank members of the Board of Aldermen here today in their decisive action. And to the community leaders standing beside me, Dr. Love Holt, Mallory, who have been fighting this fight years before today. Last month's reversal of Roe v. Wade by the U.S. Supreme Court is what brings us here today. The passing of this bill solidifies our commitment to make sure residents in our community have equal access to reproductive health care, including abortion access through logistical support. So let's discuss the benefits of reproductive health. As a medical doctor and public health expert, but also as a woman who has quite very seriously had to navigate an oftentimes confusing and scary landscape of reproductive health care, I understand the need for comprehensive reproductive health care. It improves access to contraception products, pregnancy prevention, and abortion, screenings for sexually transmitted infections, HIV, and reproductive cancers. And it educates parents and caregivers on ways to help their teens understand their reproductive health and teen pregnancy prevention. This bill enhances the Department of Health's ability to provide equitable access to reproductive health services and work toward our vision of an equitable community achieving optimum health for all. There were struggles in accessing reproductive health care even before the challenges of COVID-19. Let me share with you some data from a Missouri Department of Health and Senior Services report. It's maternal morbidity and mortality report, right? How sick women get and the statistics around the death related to women, states that between 2014 and 2018, more than 1 in 4 of all Missouri mothers did not begin prenatal care in their first trimesters. For Black mothers, though, that number was 1 in 3. As a Black woman, as a mother to beautiful Black female babies myself, and as your director of health, I will not allow for the lack of care for women during this critical time. It limits the ability of healthcare providers to identify potential risk factors related to the health and safety of both the mother and the child. Funding identified in this bill will support efforts to remove that barrier to access to healthcare and will result in healthier overall population. When the COVID-19 pandemic started in St. Louis nearly 2.5 years ago now, it caused significant disruptions for individuals seeking reproductive health care, including birth control, annual exams, family planning services. Expectant mothers like myself at the time found themselves unable to bring partners to regular check-in. This is just one example of how the support system changed and added to racial disparities in outcomes and access to quality care in St. Louis and across the state. So what are the benefits of reproductive health care support for maternal infant health? The funding from today's bill will help with concrete equitable needs to support sexual and reproductive health, including resources like doula care throughout pregnancy, pregnancy loss, birth, and postpartum recovery. Lactation support for establishing breastfeeding in the postpartum period. And I'm gonna keep saying it, access to abortion care through logistical support. As we move forward, we are currently reviewing implementation options, and any implementation plan will follow all applicable city processes and Board of Aldermen stipulations. So in closing, the City of St. Louis Department of Health works to ensure St. Louis is an equitable community, achieving optimum health for all. Provisions of Board Bill 61, this historic bill, will help ensure access to quality health and is critical to the success of our community. A healthy community allows St. Louis residents to live our very best lives and provide for our families. Throughout this effort, the City of St. Louis looks to address high maternal mortality rates, alleviate racial disparities, and nurture an equitable future for all St. Louis residents. Thank you.
Good morning. My name is Mallory Schwarz. I use she, her pronouns, and I'm the executive director of Pro-Choice Missouri. And I have a lot of feelings about being here today. I'm honored to be able to talk about Board Bill 61 and all the work that went into getting us here to this place of innovative response in a moment of national emergency. I'm grateful for the brave elected officials, for our mayor who took a chance, who didn't act out of fear, and who won't back down to bullying. And I'm proud of the incredible Pro-Choice Missouri team who put so much love, sweat, and tears into making this happen. And finally, I am in awe of the community members, the leaders, the birth workers whose leadership and partnership is responsible for this legislation. You know, almost 2 years ago, I was told by national groups that this couldn't be done, not in Missouri. Yes, in New York, yes, in Portland, and even in Texas, where the Austin Council passed support for abortion support in 2019, but not in Missouri. We did not stop. We were not deterred, and after a year of policy research, legal review, partnership development, community engagement, most importantly, meaningful community leadership, when Roe fell, St. Louis had a plan. Today, in the aftermath of the U.S. Supreme Court overturning Roe v. Wade and the loss of the legal right to abortion in Missouri, the nation is in crisis. People across our state, our region, and our country are forced to flee their homes to Southern Illinois for basic health care, for legal abortion care. Board Bill 61 is a bold and powerful action by the City of St. Louis to meet this moment, to meet the needs of the people of St. Louis right now. We are the first city to fund abortion access through logistical support with ARPA funds, but also the first to center and include comprehensive pregnancy and postpartum support for our community members. This action was developed by community health advocates, providers, and people living in St. Louis with personal experience navigating local access to pregnancy and birthing care, including abortions. And what is truly innovative is having a city government that recognizes that abortion is a central and essential part of reproductive health care, and that each person across their sexual and reproductive lives has a variety of needs and experiences. One person in their life may carry a pregnancy to term, become a parent, experience a miscarriage, and have an abortion. In creating the Reproductive Equity Fund and allocating $1.5 million to address the concurrent crisis of the ongoing COVID-19 pandemic, the maternal and birthing person mortality rates, and the loss of abortion access, support from the fund will be accessible to trauma-informed, trusted, culturally competent, and anti-racist community providers already serving our region. The goal of this fund is to support pregnant people in all of their options. And rather than other abortion, how truly groundbreaking, how truly groundbreaking it is to recognize and center in one piece of legislation the full spectrum of health needs for each of us. While we wait for our federal government to take effective and impactful action, we are reminded of the critical importance of looking to local leadership. This legislation is an example of both the power of our grassroots movement and how local leaders can and should partner with community members and advocates to advance solutions to devastating public health problems. In a state like Missouri, one of the most hostile places in the nation for pregnant people and ground zero for abortion access, this fund further solidifies St. Louis' role as a national municipal leader on equitable access to abortion, pregnancy support, and comprehensive sexual health care. Abortion is normal. Abortion is basic health care. And being denied an abortion has serious consequences. Therefore, ensuring safe access to abortion is an essential part of protecting the bodily autonomy of people experiencing sexual and domestic violence, of supporting family and community health and well-being, and promoting economic stability. The people closest to the problem are closest to the solution, and our hope today is that our city's action will inspire further opportunities for both a national response and for more municipal governments to make meaningful investments in community-based programs and services that center and affirm the most fundamental right of each of us to make our own decisions about our bodies, lives, and futures. Thank you.
I just want to say I'm Dr. Love Holt, and I want to thank all of our amazing community leaders, our mayor, fearless leader, Dr. Mahdi, and everyone here. When I found out I was pregnant in 2018, I already had 4 children and was trying to escape a domestic violence relationship. I knew at that point I wanted to get an abortion. I didn't really qualify for the Medicaid in my area, so I didn't have any health coverage at all. But I knew where to turn. I instantly called Planned Parenthood and, of course, my support system. But even though I was surrounded by people that loved me, the barriers I faced in accessing my abortion because of anti-abortion politicians who don't know my story, who don't know my life experiences, they made my abortion an unnecessarily difficult experience. I knew in order to end my pregnancy and fortify my fragmented family at home, I had no choice but to navigate these political hoops and logistical obstacle course to just have a simple procedure done that would save my family's life. The medically unnecessary hoops, including multiple appointments, inaccurate counseling, all of these things delayed me. On top of having to find child care, having to take days off from work, it just made this experience more expensive than it needed to be. I was fortunate though. I was able to get that child care. I was able to get myself to the clinic. I was able to get my procedure that day and get the financial support to get an abortion. My abortion helped me to keep my feet firm on the ground as I took my children and ran from that relationship. I allowed myself to be here and do the work that I do today as a reproductive freedom organizer and storyteller with Pro-Choice Missouri. Today, I train and I organize with birth workers in my community, helping them to tell their stories and to be effective in that. And through this work over the past 8 months, it's been my great privilege to get to talk to all of these community members, women and pregnant people who've had similar experiences to mine. But unlike me, there are so many people in our city that are not able to get the care that they want and deserve. So many instead feel abused by their healthcare system and our state. When I think about the countless conversations that I've had and all the people in this current crisis that will not and may not have that same opportunity that I did, the liberation that it affords us, the reproductive freedom that they could feel, I know it's just not enough to sit by and point to politics or wait for the perfect moment. We need to act now. And we are. This bill, Board Bill 61, I am proud to say was created by those very community members that I sat and spoke with. It was crafted by those community members who help in the birthing community, who are already and empowered to fight back. And our victory today is because of that community advocacy and because of my abortion. It brought me here, as well as many other experiences over the decade, to this very place that I'm proud to be in. The day after my abortion, I felt so much lighter, and today, I actually feel full of hope. Because that experience, that one experience, helps me to really understand and identify with the members in my community that I live and work and eat with every day, and how they can be affected by these laws. A firsthand account of those hoops and boundaries making a situation that's already bad even worse. So I'm grateful for our city leadership for lifting up the voices and the needs of those birth workers and the people in our community and the reproductive capable people. Together, we are making a change in St. Louis, and that change, I know, will inspire the nation. Thank you.
Thank you, everyone. We have time for 3 or 4 questions.
St. Louis County was unable to get its version of this legislation passed. Do you have a reaction or a comment on, looks like these are going to be moving in lockstep and then politics? Well, I'll just say that I am grateful for those who supported the bill at St. Louis County yesterday.
But there are going to be some constituents that are concerned about the use of ARPA funds for this purpose. What do you say to people who say that this money should have been better used towards issues like public safety, policing, other things in the community?
I think that we can have a both and approach, not an either or approach. We can take care of our infrastructure needs, our streets, our trash pickup and all of those, and support people in their access to reproductive health care at the same time.
Are you concerned at all about the money being tied up during a lawsuit with the Attorney General? You kind of mentioned that he intends to sue. So does it feel like a moot point signing this bill and then potentially having all the money kind of sitting in this legal battle?
I'm not worried at all about what the Attorney General does or says.
I have a question actually for Alderman Laffey. You came into this Friday, first day on the job, basically were like, hey, here's this major bill to vote on, and you're standing up here with it. Can you, if you want to, certainly don't mean to put you on the spot any more than you already were, but just, what that was like to know you were a margin on this or helped with it.
I mean, I don't really think this is my story to tell. I'm just really happy that I was able to be here to help make sure that folks are able to have health care in our city. That's not my story. Thank you.
One more.
When do you expect the money to start being available to the people who would want to access it, and what's going to generally be how these individuals would get access to the funding?
So basically, the Department of Health will be moving through the implementation process. We have to decide on the appropriate route, but whatever route is taken, it will be through the appropriate legal action and the stipulations of our Board of Aldermen process. So that will be ongoing now that we have this bill.
And is there an approximate time frame? I know obviously these processes do take time, but are we looking at end of the year, couple of months? What are we looking at?
My mayor is signing imminently. The moment she signs, we get to work. And then we have to go through these processes. It's hard to know a timeline until we know for sure exactly which avenue we're empowered to take.
And speaking of, thank you, Dr. Mahdi, for that incredible segue.
you want to do my comment?